Hello guys, welcome to SKK Classes NZ again. Today I'm going to discuss a new topic with you that is known as hypokalemia. As previously we have discussed hyperkalemia, and in the same way now I'm going to discuss with you that is hypokalemia. So what is actually the hypokalemia is, and what are the main causes, and what are the main sign symptoms that will occur in hypokalemia, and what type of treatment that we can provide to the patient who is suffering from the hypokalemia. So what is hypokalemia? As in our previous video in hyperkalemia that we have already discussed, the normal potassium level in human body is 3.5 to 5.3 milli per equivalent liter. Okay, so if the level of potassium get decreased less than 3.5, then the patient can suffer from hypokalemia. So this is the actual definition of hypokalemia. And if the potassium level get increased more than 5.3, then it is known as hyperkalemia, that I already discussed in the previous video. In the same way, if the potassium level get decreased in your body less than 3.5, then it is called as hypokalemia. So let's discuss some causes that what are the main causes that why the potassium level get decreased in our body. So see this picture. See this picture where the normal potassium range and low potassium range and high potassium range is given. So that I already cleared to all of you that if the potassium level is less than 3.5, then it is called as hypokalemia, and if the potassium level is more than 5.3, then it is known as hyperkalemia. And hyperkalemia is again you can say differentiated into mild, moderate and severe. So this is the picture that is showing the indications or indicators of low potassium level and high potassium level. Now let's proceed further. We have to discuss the main causes of the hypokalemia. Now see in this picture, the first main cause of hypokalemia is decreased potassium intake. Now what is decreased potassium intake? Means if you are taking less potassium in your diet is insufficient and it's not contain potassium, then lot of chances are there that you can get hypokalemia. Second main cause is the abuse of laxatives. Means if you are taking lot of laxatives, so that will cause diarrhea. So in that situation, the extra reabsorption of potassium will be there and you will get hypokalemia. And third one is your vomiting. Okay, if you are due to some any condition you are having a vomiting more than normal, so that will also you can decrease the potassium level in your body. Then comes your metabolic alkalosis. As I already discussed in the previous video of hyperkalemia, that if the metabolic acidosis is there in the patient, then the patient will goes in hyperkalemia, and if the metabolic alkalosis is there, then the patient must get hypokalemia. So this is the main difference, okay, because in hyperkalemia metabolic acidosis is the main cause. In the same way, in hypokalemia metabolic alkalosis is the main cause of the hypokalemia. Next one is your diuretics, that is loop diuretics or thiazides. As you know that in our previous video of hyperkalemia, we discussed about the diuretics. We always give the diuretics to the patient as a medication or as a treatment in case of hyperkalemia, so that the urine production will increased and the extra potassium that will removed from the body. But in here, in hypokalemia, the diuretics sometimes become the main cause of hypokalemia. Means sometimes what happen that diuretics increase the urine production, and sometimes what happen that the potassium, lot of potassium get excreted from the body. And if a lot of potassium get excreted in the body, so sometimes body become deficient of potassium. Okay, so whenever we are giving diuretics to the patient, we must keep in mind that it can lead to hypokalemia. So we have to be very much careful about that thing. Okay, so these are the main causes of hypokalemia. Now let's proceed further related to the sign and symptoms of hypokalemia, that what type of sign symptoms will be there if the patient is suffering from hypokalemia. So these are the main sign symptoms if the patient is having a deficiency of potassium in the body. First one is a weakness and fatigue, means patient always will feel weak and fatigue. The blood pressure will decreased, okay, low blood pressure. Then patient always have a difficulty in breathing. Then heart palpitations are there. Then patient always suffer from tingling and numbness, or having always complaint to you that I am having a tingling and numbness sensation. Then muscle cramps, and patient moods also get changed. Okay, sometimes he gonna happy, sometimes he gonna sad, so mood swings are always there. And patient always complained that I am having some digestive problems, whether it can be constipation or it can be diarrhea. So these are the main sign symptoms if the patient suffering from hypokalemia or deficiency of potassium. So if any of the sign symptom is present in the body, so it means that you must have a deficiency of potassium in your diet. Okay, so and you have to take the treatment of hypokalemia. Now let's discuss the treatment line for the hypokalemia. So first line treatment is correct the volume depletion and under treatment of underlying etiology. Means whatever the main cause is there in the hypokalemia, we have to correct that one. Suppose if the patient is on loop diuretics or on thiazide, so first we have to we have to do, we have to stop that diuretics, so that the potassium that will not get decreased or excreted from the body, just to treat the hypokalemia. Next line treatment is serum potassium drops by approximately 0.27 mm for every 100 mm reduction in total body stores. Means we have to start the potassium drops, or apart from this we can also give oral supplement therapy to the patient, like syrup, pot chlor, okay, just to treat the hypokalemia. And next one is your, if mild hypokalemia is there, then we have to start the oral potassium supplementation, that I already told you that we can start the oral supplement therapy. It may be in the form of syrup, or it may be in the form of to provide potassium diet. Means the we can provide, or we can told the patient to take more and more that food which is rich in potassium, because first line treatment always started with oral therapy. Okay, so we must concentrate on the oral therapy. But if the patient is in critical condition, or if, like suppose if the patient is on ventilator, so in that situation we always start the potassium infusion, okay, at the rate of 20 milli equivalent per hour less than. Then potassium infusion, if we are giving or to the patient in peripheral veins, okay, in peripheral veins mean through a cannula, okay. So the infusion rate must be less than 40 milli equivalent per liter, okay. And if we are starting the infusion in the central vein, central means if the suppose I already told you, if the patient is in critical condition, he or she must be having a CVP insertion is there, so in that we can start the less than 60 milli equivalent per liter the infusion rate. Okay, so next one is your monitor potassium during therapy. Means whenever we are providing, or we are giving up the potassium to the patient in infusion form, we must monitor the things, because all patient can have any type of problem if we are like in the during the process of infusion. So we must monitor that potassium a level, and after giving the infusion, we have to send the blood sample to the lab, so that we can know that how much potassium level now it's there after infusion. Okay, because if we are not if we are continuing the infusion, it may be possible that patient can goes in hyperkalemia, so that is also a life threatening condition. So we must concentrate on the monitoring of the patient. And last one is your search for and treatment of magnesemia. So you already know that whenever we never give the patient KCl, means potassium chloride, directly. Okay, we always give with the combination with magnesium, means in mild cases we always provide 1 KCl plus 1 magnesium, it are in the ratio. And if in the potassium level is very much less in the body, so we always give the patient 2 KCl, 1 magnesium, 1 cycle or 2 cycle or 3 cycle. It depends upon the patient condition, that how much potassium is decreased in his or her body. But whenever we are giving potassium to the patient after some, okay, after infusion, we have to monitor the again potassium level in the body. So these are the main treatment line which can be provided to the patient if the patient is suffering from hypokalemia. Okay, so now I'm displaying some pictures of food that are rich in potassium. Means if the patient like potassium level is decreased, and doctors advise you to take oral therapy, so or oral supplements. So what type of food that you have to eat to increase your potassium level in body by your own. So this is a potassium rich food which includes your almonds, sprouts, broccoli, tomatoes, coconut, avocado, figs, cantaloupe, beets, bok choy, spinach and apricot. So if the patient is suffering from hypokalemia and doctor advise you to take potassium in your diet, so these food you can eat so that potassium level get increased in your body. So this is all about the hypokalemia, its signs, symptoms, its main causes and its treatment line, and potassium rich food. If you have any query, you can contact me on my WhatsApp. Okay, and thank you for watching Ask Kiki Classes NZ, and don't forget to subscribe my channel and share it as much as you can. Thanks a lot.